Hello everyone, Dr. Dvoskin here again. This time I'm here to talk to you about neck pain, which is related to an injury of any type. There are numerous reasons we all develop neck pain after sustaining either a motor vehicle accident, slip and fall, or a work-related injury. They go from the benign to the much more urgent and requiring immediate attention. Let's talk about some of the things you may feel after you sustain a neck injury. The most common complaint will be stiffness in the neck. You may have difficulties trying to turn your neck to the right or to the left, forward, flexion, or extension of the neck. You may have headaches afterwards. You may feel like something is constantly weighing you down and there's a pressure in your neck that you just can't shake off. These are all things that anyone can experience after anything from a mild to a severe injury. Let's talk about the actual reasons of what's going on in your neck. So here's our handy spine, which I'll use to explain some of the anatomy of the neck, and this will help us understand what happens. So if we look at our necks and we rub the back of our neck, we usually feel the bones called the spinous processes here. A little bit deeper down, we have the joints of the neck, and if you look closely, you can see that there's a lining in between and it wraps around to the front. The nerve roots run right in the front of the facet joints, as they're called, and we have our discs all the way in the anterior or forward portion of the neck. I always think of our discs as the shock absorbers of our spine. They're made up of a cartilage somewhat similar to our ears and an inner fluid-filled nucleus pulposus. And if you think about it, when we're all young and happy, the discs are well hydrated and they're doing their job. But if you sustain any kind of injury, you can imagine that what can happen is a tear, and it's called an annular tear on the outside of the disc, and it's going to start to leak inflammatory chemicals out. And the first response that we're going to have is to stiffen up our neck, and it's our body's natural response. We are prone to try to decrease our pain, and the mind tells us that if we don't move it, then it'll hurt less, and which is why you'll start to feel stiffness right away. From an injury, you could sustain an injury to the disc itself, you could injure your nerve, you could injure the joint, or you could have a broken vertebrae, compression fracture, or actually any part of the bony structure can be broken if the injury is severe enough. Usually those kind of fractures are medical emergencies and you'll need to be seen right away in the hospital for a full evaluation. Let's talk a little bit more about the disc itself. So when you have a herniation in the disc, you'll notice that you have decreased range of motion of your neck, and you'll also feel this non-specific pain. Now, if the disc reaches back and hits one of the nerves, you're going to start to feel numbness, burning, or tingling, usually going down the arm at this level. Depending on where it goes in your hand will give us an idea of which nerve you may have injured. Now, sometimes if the nerves are a bit higher up, you'll start to develop headaches. They could be tension headaches. They could even be migraine headaches with time. You could also have a specific type of headache called an ice pick headache, which shoots right across into your eye from an injury to the upper nerves of the neck. What else can be done in terms of injury? You could have a traumatic arthritis of the joint, which runs in between here. It'll flare itself, giving you more inflammation, more stiffness. You can notice that you're having sharp pain. That could be either from the nerve, the disc, or the joint itself, and it needs a full workup/evaluation. Other types of injuries are just the muscles themselves. Let's say you didn't have a specific injury to the disc, the nerve, or to the joint. You could have still injured the muscles. You could have had a sprain, you could have had strain, or a contusion if the injury was severe enough. This will cause, once again, inflammation, and this will too cause you to have stiffness and pain. Let's talk a little bit about what happens when we injure the muscles themselves. Stiffness, decreased range of motion, and you'll have a lot of pain upon flexion usually. What you will find yourself is probably feeling some relief with medications such as non-steroidal anti-inflammatories, which are commonly your ibuprofen or Motrin, as well as maybe a muscle relaxant can help certain patients. Heat generally also helps, but you need to talk to your provider if it's advised right after injury, or we need to start a full evaluation before prescribing any medications or modalities, which include heat or ice.